Okay, good evening, Dr. Ajayi. So my name is Benga Saka, and thank you for coming on board to have a chat with the baristas in Hangout Cafe. So I just need to invite you to Hangout Cafe. It's an opportunity for people to meet and to talk about relevant issues, whether it be health or whether it be finance or it can be anything. But it's just a way of trying to empower people and enable people and bring people out of any kind of misery or mishap that they might be going through. We're in November, which is technically a man's month, so it's when we focus on men's health. And the idea is that throughout this month, we want to talk a lot about men's health. When we look at men's health, we can look at it three-dimensionally: spiritual health, mental health, and physical health. But what I want us to try and focus on today is really on mental health. I know I've called you Dr. Ajayi, but before I carry on, do you mind telling us a little bit about yourself, as who you are, what you do, why you do what you do, and what you enjoy in what you do and keeps you going?
Okay, right. To start with, thank you very much for having me on the program. It's always a joy to be able to share my thoughts and to be invited to share thoughts, particularly with when it comes to men's mental health. That's something that I'm really passionate about. As you say, I'm Dr. T. Ayodele Ajay. I'm a consultant psychiatrist working in the NHS. But in addition to that, I wear a number of other hats. I'm also the convener of the Tripart Care Emotional Wellbeing Hub and Tripart Care Emotional Wellbeing Workshops, which is really a safe, sensitive space for Black people, particularly Black church people, to rub minds together in terms of talking about issues that pertain to mental health and mental well-being as it relates to our contemporary world, and particularly the Black community specifically. So that's about me. And in terms of what I do and why I enjoy doing it, I think um, mental health is something I'm passionate about, and sharing mental health education and literacy is something that I really think it's important because my conviction is that many times we have our body, we have a soul, and we also have our spirits. And many times, if we neglect one to the detriment of the other, then things become lopsided. So it's important to pay attention to all the three parts of us. And I think that's something that I'm passionate about, to provide holistic information about taking care of all the three parts of us, really.
And you look very relaxed at the moment. So what are the things that you enjoy doing and what keeps you relaxed? And I'm going to use the word, if you don't mind saying.
Yes, thank you. That's a very nice question, actually. So I'm a very enthusiastic gym. I'm a gym enthusiast.
Hmm.
I like going to the gym, but also I enjoy traveling. Lots of local travel within the UK, countryside, visiting the countryside. I also enjoy walking and engaging with nature. So I've got happy places that I like to go to because they chill me out and they just keep me grounded. And of course, family time. I'm a family man, and I enjoy spending time with my family.
Brilliant. Obvious. You and I share a few things in common, particularly the love for nature. So maybe that's something we'll explore at some other time. So the reason why we brought you here is really to talk about men's mental health, and I believe you're going to look at it in several dimensions. But one is from the point of view of somebody practicing in the UK versus the point of view of somebody who has lived in Nigeria or in Africa and has seen things and things evolve. But also in terms of trying to define things like what is mental health, what is mental health well-being. So open to you.
Okay, right. I'll first start by talking about what mental health is, using the formal definition, which is from the WHO, the World Health Organization, and there's no other place to go to than to go to them, really.
Mhm.
The first thing is that there's no health without mental health. I think it's very important to start on that ground because many times people talk about physical health, we talk about, and we think that that's the only form of health, but really, um, there's no health. Health is not complete without mental health. But what we also do know is that mental health is not just an absence of mental illness, because many times in our community, people think that because they don't have a diagnosed mental illness, that they are in good mental health. But that's not necessarily the case. According to the World Health Organization, they say that mental health is a state of well-being
Mm.
when an individual is able to fulfill their potential. So really, if for any reason, either emotional reason, either from for trauma or things that we've experienced in our lives, we are not fulfilling our full potential, that might be impacting on our mental health. So they say it's a state of well-being when an individual is able to fulfill their full potential. They're able to cope with the normal stresses of life. We talked about lockdown just now. So when we're in a state of good mental health, we're able to cope with whatever life throws at us, the highs and downs. You've talked about financial, you've talked about even sometimes family stress, you've talked about job stress and all of that. We're able to cope well. That's also a function of mental health. And the other function of mental health is that we're able to work productively. So being able to work productively is also a function of our mental health. And finally, apart from working productively, we're able to contribute to community. For instance, what we are doing now, this is not formal work, but this is contributing to community. And it's
Mm.
looking at those four aspects. Those are the so to say, those are the indices that you use in looking at good or poor mental health. And the other thing to know about mental health is that it's not a fixed thing, it can vary. So
Mm.
people can move from a state of good mental health to a state of poor mental health, depending on what's happening in their lives at the time and how they're coping with it. But I think the important thing is that the fact that somebody doesn't have a diagnosed mental illness or that they don't have a known mental illness does not mean they're in good mental health.
So I say you've used two words there deliberately: good mental health and poor or bad mental health. So what constitutes good mental health? What constitutes bad mental health or poor mental health?
Right. Okay. Thank you for that question. So, good mental health would be somebody who ticks all those boxes.
Mhm.
They are fulfilling their potential. So they are operating at par. They are operating at maximum potential. They are also able to cope with the normal stresses of life, and things happen. Maybe a job loss, or
Mm.
maybe even sometimes bereavement, sometimes economic crime, pressures,
Mm.
sometimes even positive things like having an empty nest. Believe it
Mhm.
or not, that's a life event, and
Mm.
sometimes I know. I know a number of middle-aged couple who say that suddenly, when they entered into empty nest, the reality suddenly struck them that their children are not going to live with them forever. I mean,
Yes.
I know the impact that suddenly entering into an empty nesting phase or beginning to enter into an empty nesting
Mhm.
phase, the impact it had on myself and my wife a few months ago. And those are the realities of life. So it's
Mm.
really, so good mental health is we're able to cope well with those pressures. Yes, there are changes, but we adapt well and we find other things and it doesn't knock us out. Poor
Mm.
mental health is either when those things then knock us out of kills. And the way we'll know is that when we look at when there are physical problems, for instance, if somebody suffers a heart attack, we look at it's the heart that has a problem. If they have a stroke, it's the brain that has a problem.
Mm.
If somebody has a mental difficulty or mental problem, there are three areas to look. Is the area of thinking, the
Mhm.
area of emotion, and the area of behavior.
Mm.
Because many times people say, "Oh yes," people say mental health. What is it really? We can't say anything because if somebody has a bruise or they have a stroke, we know they probably have a deformed face. They probably
Yeah.
have paralysis of their arms. They might not be able. There might be motor problems, motor function problems. If somebody has a heart attack, we know it's the
Mm.
heart. We know the features to look for. But for mental illness, people say, where do you really look for? The places to look for are thinking, emotion, and behavior. And sometimes it could be a mixture of the three. It could be just thinking, it could be just emotions, or it could be a mixture. And the other thing we also know is that it tends to be, it starts from the thinking and then it affects the other parts.
Now, you've talked about thinking, emotion, and behavior. Is that what constitutes the mind, or how do you define the mind?
Oh, good. Yeah. Yeah, the mind is the area of our being. Um, the mind is the area of our being where we have our intellect.
Mhm.
Um, it's the area of our being where we have our decision making faculties. It's also the area of our being where we have our emotions.
Mm.
So all of those constitute the function of the mind. Is the places where we have our decision making, where we make our choices, and where we process our emotions as well.
So we've talked about mental health. What about the diseases? What are the diseases that affect the mental health? So what are the things
Right.
that you can
Good.
find, or the
Good.
various dimensions of mental illness?
Right. So a good way, a very easy layman's way, which everyone will be able to relate to, is to see mental health in three different ways. To look at it from three different angles. One, that we all have a mental health. Many times in community, in doing this work, I hear people say, "Oh, that person has mental health. That brother, that sister, that man, he has mental health. So be careful. He has mental health. So everybody has mental health. Just like we say, that man has a head, though, or that man has fingers. Everybody has mental health. It's just that, like I said earlier, there can be poor mental health and good mental
Mm.
health. So that's mental health is a state that every one of us have. It's a function just like our physical health. But in addition to that, we can also talk about common mental health conditions or common mental disorders. And in the UK, there are about 1 in 6 people who suffer on a weekly basis. About one in
Mm.
six people in the
One in
population.
six.
Yes, it's quite. It's that. Yeah. When people hear that, they think, "Oh, wow." Common mental health conditions are actually they are fairly common. 1 in 6 is about almost 20% of the population, just about 18%. So, and when we talk about common mental conditions, we are looking at anxiety, generalized anxiety. We are looking
Mm.
at mild depression. Um, so, so the other reason why I quoted that figure is for us to know how common these things are. Also
Okay.
in the UK, we know that 1 out of 4 of us would have experienced a mental difficulty at some point in a lifetime.
Okay.
So
So it's not all mental health, because if we say 1 in 6, that means about 20% of the population. So if
that's
you
the
count
common
one,
mental.
two, three, four, five, six every time, one
Yeah,
person will have a mental health issue. But it's
that's
not every
common.
time they have to be taken away. So people can
No,
be in the community and still
yeah,
have mental health issues. So
yeah,
and because it's mental health and it's things of the mind, it's not something that you can see physically or measure
absolutely.
with any kind of
Yeah,
apparatus.
yeah. So, so, so it's good to think about the fact that that's 1 in 6 for common mental health conditions, like I've said, anxiety, obsessive
Mm.
compulsive disorder, mild depression as well. That's about 1 in 6. But then we also do have what is called severe enduring mental health problems, and
Ah.
many times in our Black communities, that's the one, particularly that's the one we are very familiar with in
Mm.
terms of from maybe some of us that grew up in Africa. By
Mm.
the time we think about mental illness, we are looking at somebody who is completely psychotic, who is probably stripping and walking the streets, who has
Yes.
no, who have lost control totally of their
Mm.
faculties, of their thinking faculties, and
Mm.
but that's only a very small proportion. When you look at the population, the large population of people who have the cohort of people with mental problems. The ones with severe enduring mental illnesses are they are the smaller part of that proportion. Um, and that those conditions include bipolar affective disorder, or which
Mm.
used to be called manic depression, or schizophrenia, which is
Mm.
an enduring severe psychotic illness.
Mm.
Uh, and then severe personality disorders and severe depression also could fall under those.
Okay. So I see people use the word psychotic. I see people use the word manic depressive. I see people use the word schizophrenia. I
Yeah.
also see here people being sectioned. So what is what in all of that? So how does all of that relate with mental health, particularly with poor mental health?
All right. Okay. So that's a very relevant question. So let's start from psychosis because that's an umbrella term. So
Mm.
when somebody is psychotic, that's somebody who has lost touch with reality. It's almost like that person's mind is broken.
Okay.
When somebody has a fractured bone, their bone is broken. When somebody has a fractured heart, they have a heart attack. When somebody has a fractured brain, they've got a stroke.
Yes.
If we look at it like that, when somebody
Mhm.
has a fractured mind, they've got psychosis.
Okay.
And psychosis means that there's a loss of touch with reality. in which there are 2 or 3 things to look out for. One of them is, I talked about the area of thinking.
Mm.
People who are psychotic begin to they hold thoughts that are not in alignment with reality. So some of them experience delusions.
Mm.
Delusions meaning that they hold tenaciously onto thinking, onto thoughts that are not in keeping. So somebody, for instance, believes that that the CIA or the MI5 or the MI6 are after them.
Mm.
They no longer leave their homes. They even will not allow members of their family to use to use any phone. They switch off all the electrical gadgets in their home because they believe that any of those electrical gadgets will make them vulnerable to the MI5 or MI6 coming to get them, or that their phone is being tapped, or their laptops are being tapped. And they really believe those things. That's their reality, which is no
Mm.
longer the reality that is no longer reality. So
Yeah.
that's one delusion. And there could be other forms of thoughts. They could believe that their thoughts are being controlled by the MI5 or the MI6 as well. All of those
Mm.
things happen. So that's in the area of thinking.
Okay. So the question then is, who gets these mental health disorders, and why do they get it? So is it something that people are predisposed to? Is it something that they do that gets them into that stage? And then in relevance to black men, how does it affect black men particularly?
All right, good. So I'm going to hold that question. I'm going to hold it on my left hand because I think
Okay.
it's a very important question. But I'll just complete the bit about psychosis. So we talked
Yes.
about the thinking, but the other thing that people with psychosis get, that they may get, no, it's not all the time, is that their sensation, they also lose contact in terms of sensation. So they very commonly hearing voices, that they begin to hear voices that no one else hears. The voices
Mm.
could be critical, they could be derogatory, they could be running commentaries on their actions, they could be calling them names or giving them commands. And anyone else, every other person does not hear the voices. Sometimes they
Mm.
call them names, call them by their names. So, and then that would then lead to periods of agitation,
Mm.
restlessness, hyperactivity, all of those are, so that's what makes up the component of psychosis. It's the interference with thoughts that are not in keeping with reality, having experiences or experiences that are not in touch with reality in terms of their sometimes it's visual, but usually it's auditory in terms of hearing. So that's for the psychosis. Manic depression, as you said earlier, is really also when it's a form of mood disorder where somebody has extremes of mood. They have long spells of depression, but then long spells of high mood as well. And long
Mm.
spells of depression could be several months where they're just depressed, they can't get out of bed, they have poor appetite, they are just really on the low. They feel very sad. They could feel to the point of wanting to take their lives and be suicidal. They lose interest in every activity of life. Everything just becomes down. But then there's also the extreme poles where most people have a sad day. Every one of us has a sad day now and again,
Mhm.
but we go back to normal. But for people who have manic depression, um, they could have months and months when they're just like that in the low mood. But then what we also know about them is that they also have periods of high mood that is more than just passing an exam, passing the PLAB exam, or passing the fellowship exam, or it's really high in terms of spending a lot of money, going staying up all night. Um, Sometimes as well, people will then begin to use drugs and alcohol. People can also become they can become sexually disinhibited, where they will do things that they wouldn't usually do and put themselves at risk. So that's for
Mm.
manic depression. Now, going back to, did you want to say anything before I then
No,
answer?
carry on. No, I just want you to go with the flow. I'm learning a lot of things from
All
you.
right. So now, when we then go to what are the causes of mental illness, I like to one of the things that I like to do is to simplify things very much. And so I use mnemonics a lot. So I talk about the 4 N's of the causes of mental illness, 4 N's.
Mhm.
So that's nature. So it's nature, nurture, nature, nurture, narcotics,
Okay.
and
And by
negative
narcotics,
life
you mean
events.
drugs.
Yeah, and I'm going to split. So nature is
Sorry, what
that
was the fourth one? Nature, nurture, narcotics.
negative or positive
Okay.
life events.
Okay.
Negative or
Thank you.
positive life events. So the nature has to do with the fact that there are people who have parents or who have siblings who have a mental illness, particularly things like manic depression, bipolar affective disorder, paranoid schizophrenia, recurrent depression. All of those we know they flow in families. Even we know that autism, for instance, all of those tend to run in families. But the thing about it, so that's the nature. But also the other thing about nature is also that some of natural predisposition, the personality that the way we are naturally wired.
Hmm.
So for nature, the thing about it is that the fact that somebody inherits a gene, the fact that maybe it's in the gene, does not necessarily mean that the person will manifest mental illness. And I think that's really important.
Hmm.
The way to describe it is this: if one has a loaded gun, you load a gun and you put it in your loft room, and the 20 years or 40 years you've been in the house for long and nobody touches the gun, it's just safely in the loft room. Suddenly the person gets their children, leave home, they get grandchildren, and one day the grandchild goes upstairs to the loft room, does not know, and pulls the trigger. Just hypothetically here,
Hmm.
that gun had been loaded all along. Because the trigger was not pulled, there was no explosion. The
Yes.
day the trigger gets pulled, there's an explosion. Now,
Yeah.
the weight it transmits to mental illness is that the genetics, the nature is the loading of the gun.
Yes.
The pulling of the gun is stress and life events. So the import of that is so people might be predisposed by the nature of the genes, their
Mhm.
family history, or also by the nature of their natural predisposition, the way they are wired. The natural predisposition has to do with people who are naturally introverted and who lack not just an introverted, but who lack confiding relationships. People who lack confiding relationships at more risk of depression, for instance.
Okay.
People who are ruminators, people who tend to take things very personal and ruminate and think about it and think about it and think about it, and they are so engrossed that can be a risk. But the good thing is that those
Will you
thinking patterns
consider
can be
those
broken.
people, if somebody is naturally quiet, are they likely to be a ruminator or introverted? Or I'm just trying to make sure that we don't start labeling people inappropriately or
Oh,
incorrectly.
yes, exactly. That's why I said that it's a possibility that
Mhm.
because somebody might be quiet, but they have confiding relationships in their lives. I
Okay.
mean, the reality is that people don't usually believe that, but I'm quite an introverted person. I know that it doesn't come across like that now, but
Mhm.
that's because I'm doing something that I'm really very passionate about. But
Yes.
I am aware, so I've got confiding relationships in my life that I really those are relationships that I nurture, and
Okay.
I'm able to express myself. So that's for nature. Now the nurture, which is a really big one. If there is one message that I want to really put out very strongly on this program, it's really that the power of nurture in um, in making children at risk of mental illnesses in future. A very and nurture is about how children are raised. Simple. And did you wanted to say something?
No. I'm dropping my pen and I'm listening attentively
All
now.
right. So nurture is about the way children are raised. So
Hmm.
children and to think about it is the home environment. That's about three E's: environment, the home environment, their education, and the experiences they have in life. So it's home environment, as in the
Hmm.
environment at home, education, and the experiences they have.
Hmm.
And so, there's research that is showing that when children have more than four adverse childhood experiences in terms of maybe parental neglect or emotional neglect or physical abuse or sexual abuse or parental chronic parental discord, all of those things, or when they witness domestic violence at home, or there is a parent who uses drugs, or there is a parent who is into alcohol addiction. When children are exposed to all of that, or there's sibling rivalry that is not controlled, when children have more than four of those in their lives, they are significantly higher risk of developing mental health problems in the future. So that's the nurture part of it, the way children are raised.
So it's quite important. Do you mind just going over that again? Because if there's a message that I also want people to take home, because this issue about nurture and the fact that their home environment, their education, and their experiences can have a significant impact on their future mental health. And if they have more than four of those experiences, things like home disputes,
Parental
witnessing domestic,
discord, parental, yeah,
parental discord,
domestic
abuse,
violence.
domestic violence, sexual abuse,
Yeah,
use of drugs by people around and about them. If they have more than four, it
yeah,
can significantly impact their mental health in future.
yeah. And what is more worrying is that the heavy impact of adverse childhood experiences is
Mm,
such that not only does it then affect people who have experienced adverse childhood experiences at higher risk of depression, higher risk of anxiety disorders as they grow up, post-traumatic stress disorders, almost all mental illnesses actually. But it doesn't stop with mental illnesses. It goes on to physical health problems as well.
mm.
Obesity, diabetes, cancers have been linked to adverse childhood experiences. What is also even worrying is that there's a generational part to it. That people say that people who have experienced adverse childhood experiences and have not dealt with it, when they start parenting, they carry it on to their own children and they propagate that into the next generation.
And then
So,
when you then add nurture to nature, we are almost doubling the risk of
so,
developing
so
mental
it's,
health.
it's, it becomes really compound, and usually it's when those things combine, because it's not just one single reason why people become
Mm,
unwell. And of course, the other one is then negative or positive life events. Negative life events, bereavement, job losses, financial pressure, homelessness, poverty, all of those things, all of the, and of course, there's also positive life events. The one, for instance, that we don't take really, I've talked about, I mean, empty nesting, children living home, it's a good thing. I mean, it means that you've done your job well and you cannot allow them to fly. But suddenly you find out that actually this place is not as noisy as it used to be. And that's
yes.
something you need to adapt to. So it's interesting. But the other thing about positive life events is things like having a first child, things like getting a promotion at work. The responsibility increases, the stress increases, the challenges increases. Some of those things are positive, like a child going to university and starting university. That's a good thing for them. It's a positive life event, but that means that they also have to adjust to university life. And sometimes positive life events, and the one that I really wanted to talk about was becoming a first-time father. We have heard about postnatal depression in women, but actually men, we are now seeing we are now recognizing that actually there was postnatal depression in men all along. We're not just picking it up, because suddenly this man has his first child and he begins to feel neglected. He's no longer the center of his wife's attention. These things happen. He now
And
has to wake up.
that baby doesn't come with a manual to read as to what you
It
need to do when that happens. So
absolutely,
you learn on the job.
you learn on the job, and then after 2 weeks you go back to work if you are not self-employed, and then you are juggling between night feeds with sleeplessness and having to work, and sometimes the man just is flat out and is suffering in silence because he doesn't feel able to talk about who talks. In what community do people talk about a man getting depressed after he's had a child? Who is he
Mm,
going to say that to? But those are
mm,
realities of life. And of course, the final one, the final end is narcotics and drugs, substance misuse, alcohol misuse. All of those are known to also, they can precipitate mental problems for those who are predisposed already. Even for those who are not predisposed, they can actually precipitate it. And when people have mental problems and they start using those substances, their outcomes are a lot worse.
So when you talk about drugs, when does recreational drug use move into misuse and then abuse?
So in the ideal sense, it's best not to touch any recreational drug. In the ideal sense, in the ideal sense, the reason is because people who start out, people who start out being dependent, they didn't become dependent overnight.
Mm.
It was recreational. They
Mm.
were first trying it out, maybe to relieve stress or maybe for peer pressure sometimes, because everyone is doing it, they do it. But then,
Mm.
of course, progressively, it then gets to the point in which they become dependent. And the features of dependence are one, that the drug now takes priority over all the other functions of their lives, such that
Mm.
they will neglect the biological functions, such as eating, sleeping, um, all the normal functions that we attend to. The
Mm.
drug takes salience. It just becomes the most paramount thing. Basically, their life begins to radiate around that drug or that
Mm.
substance. They have cravings when they're not able to obtain the drugs. And not only so, when they are not able to then satisfy that craving, they then develop withdrawal symptoms, such as physical, they will have physical manifestations. It could be sweatiness, it could be dry mouth, it could be racing heart, it could be jitteriness, all associated with not being able to take that drug. And the other thing is that tolerance in terms of the more of the drug they take, the more of the drug they need to achieve the same effect. So the buzz that they get from it, they need more of that substance to get the same buzz. And at some point, they're actually going to get the buzzes again. And just to sound a note of warning, particularly because we are really talking to men here, that sometimes those substances are actually prescribed drugs.
Yes.
Benzodiazepines, Valium, Tramadol, Cocodamol,
So we need to be
so,
very careful about those drugs.
because they are equally powerfully addictive.
And then now that you've talked about really mental health, and you've just blown my mind completely, particularly about those risk factors in terms of nature, nurture, negative stroke, positive life experiences, and to actually think that something positive can have a negative impact. So we need to be
Yeah,
very careful. And really, it really means that when people are about to have children, maybe we need to be training them to prepare them for that
absolutely.
new thing. And like you say, yes, the empty nest syndrome, it's something
Yeah,
that is really people
yeah,
struggle with,
yeah,
particularly people that have one or two children and one goes away, you have only one at home.
yeah.
So is there a particular time when people are more likely to develop mental health issues? So we've talked about the who, the when they get it, why they get it, but is there a particular time as to are younger people more at risk, are middle-aged people more at risk, are elderly people more at risk, or is there specific syndromes for specific age groups of patients?
So yeah, that's also a very relevant question. So we do know that periods of life changes, life events, and stresses can be precipitants.
Hmm.
And if they happen at any time, they can precipitate things. But we also do know that things like bipolar affective disorder tend to the first onset. Yeah, yeah. Now that you said that, it's reminded me something else. But I'll finish this sentence. The first sentence of bipolar affective disorder, it's usually in the late mid 20s to to the late 20s or early 30s. That's the onset of manic depression. Schizophrenia is a little earlier than that, usually very early 20s that people tend to begin to
Okay.
get the first symptoms. But and of course we know that dementia is usually an illness of after 65-year-olds.
Hmm.
Even though sadly these days we are getting people who are showing symptoms much earlier, probably because of the lifestyle they've lived earlier in their
Hmm.
lives, which has made them heavily at risk.
Hmm.
But in terms of mental illness as a whole, in terms of age, the interesting thing is that 50%, and this is another staggering statistic, 50% of those who have any mental illnesses would have developed those symptoms by the age of 14, 1 4, according to the World Health Organization. What is also staggering is that 3 out of 4 of those with mental illnesses in that cohort, 75% by the mid 20s. So really, it buttresses the point we made earlier about really that when we have a child, the first 10, 15 years of that child's life, we are really shaping their future profoundly in a very, very heavy way without really knowing it. And many times in our culture, there are certain things that we do like calling children names, like being hypercritical of them, being comparing children with children, making them feel not so good about themselves, all of those things, or not just giving them attention, neglect, just emotional neglect, not speaking, and what's the word I'm looking
engaging
for?
them.
Not engaging with them, not affirming them enough. And then also sometimes very critical comments, and also harsh discipline. All of those things are very detrimental to the progress and to the well-being of children in the future. And so those statistics, and the bit that's also important about the statistics is that there's a remarkable change from the 14-year-old to the mid-20s. That's another 25% of people with developmental problems. And the reality is that means that our young adults as well, many times parents in our culture will think, oh yes, Johnny has left home now. Oh, thank God. Papa Jide is now old enough. He started university, my job is done. Thank God for that. But the reality is that the COVID surveys, the government was surveying us every 3 monthly period over COVID, and they did mental health surveys particularly. And the age group who are mostly adversely affected in their mental health were the 18 to the 35-year-olds.
Yes.
They were the ones that said, wow, lockdown was just, and give it to them. I mean, it was just a different world for them. And most of them are really very socially versatile people. So to not be able to hang out with their friends was just what they couldn't hack.
Yes. Wow. Mid-teens, mid-20s, and then you look at that productive age group, 18 to 35, can be significantly impacted by mental health issues. Okay. So what are we meant to watch out for? Because I know you said, yes, it affects thinking, it affects emotions, and it affects behavior. When do we know things are veering from norm to abnormality? So what are we meant to watch out for?
Yeah, very another brilliant question. Thank you. So in terms of thinking, so it's not easy to access people's thoughts, but from what they say, you can infer. So we put that on hold first. But in terms of behavior, let's look at sleep. Sleep is number one. So if they are sleeping excessively, usually normal sleep for an adult should be between 7 to 9 hours. A good number. That's about the time we need for our brains to recuperate and to be ready for the next day, and to wash off all the toxins and prepare us for the next day. So if they are sleeping less or they are sleeping more, that's one. Appetite. Poor appetite is also another one. Low mood. And the way to tell low mood is that the person just, when people are low for long enough, you can see it on their faces, because they look sad, they look downcast, they might neglect themselves, they might not attend to their personal hygiene again. You might see that somebody who is usually very proud of the way they appear, they've just let themselves go. Those things, they are not changing their clothes, they are not washing, they are not brushing their teeth, they are not doing any of those things. All of those things are. So we've talked about sleep, we've talked about appetite, and then concentration. You just see that person is always looking like they're just there but not there. Motivation, they're just demotivated, they let everything go, their paperwork has accumulated, they are not taking calls. Social isolation is another thing. They are not active on social media, they are not responding to calls, they've become basically, they've just become dissociated, and they've disconnected completely from social activities. And also so those are, and of course we've talked about psychosis in terms of what features people get. Also they will lose interest in the normal activities. The football fan can no longer stand watching football. And for those who are in intimate relationships like as well, they will go off even intimate activities, and all of those things happen, and they can be warning signs that actually something is wrong. And their thinking will be, in terms of thinking for depression, there are three things to look out for: thoughts that, speech that betrays or that portrays worthlessness, hopelessness, and helplessness.
So worthlessness, hopelessness, and helplessness.
Worthless. So anything, oh yeah, but a man can say, oh yeah, now that he's lost his job, he's not any good to anyone again. What is he doing around any longer? It's surely that, or he might feel that, oh, he's never going to recover from this one. This is
Mm,
his end, that sort of thing. And when those things happen, very commonly suicidal thoughts and suicidal expressions also happen. So it's
mm,
also something to look out for. That when there's many times they arouse suicidal
mm.
behavior and suicidal thinking.
So now that you talk about that, because you're thinking about thinking and their speech betraying them, generally men don't talk, men don't cry, men don't show emotions, particularly black men. So how are we meant to recognize these things, particularly in a black man that just comes home, wants to go into his cave, or just goes out and comes back late? So how do we recognize that there are issues there, particularly with black men that are not exactly very good at communicating or expressing or revealing their emotions?
Yeah. That's very, it's a $1 million or £1 million question, and it's one that we're always grappling with.
Hmm.
So the reality is that those who know them well will know that there's a change.
Okay.
So there's a clear change in lifestyle. Somebody who usually leaves work, usually, and they come back home and they come and spend time with their family, or they come and watch TV, or come and play on their computer. They then stop coming back home until they, they don't get back home until 11 p.m. And by the time they get back home, they are oozing of alcohol.
Hmm.
And this is now a pattern.
Hmm.
Could be that that person is depressed, and the way they're coping with it is that they are turning to alcohol.
Hmm.
Sometimes they get more irritable. Sometimes they
Hmm.
get more angry, because that's
Hmm.
another feature where that's
Hmm.
another thing that men, another symptom that can herald or indicate that a man is depressed. It's just
Hmm.
irritable, it's just angry all the time.
Hmm.
He blows his fuse very, very quickly. That might be signs that something is, or it becomes even more withdrawn.
Hmm.
It just basically goes into his shell. Um, and so it's those who know them well. And one of the things I say to this is something I said yesterday as well, for the celebration of the International Men's Day, that it's important for men to, one, for men who are married, who have spouses. It's very important to be able to cultivate that relationship where men can confide in our spouses when
Hmm.
there's when whatever is happening.
Yes.
It's very important. But also, in addition to that, I think it's also important to have one or two men or three men in one's life that are peers, that one can really bear one's heart to. And
Hmm.
I think the way it works is that if one waits till things go wrong before one expects that that's going to happen, it may not happen. So the best thing to do is what I've coined it pre-morbid contracting, where
Yes.
I've got a friend and we say, actually, look, between you and I, if you ever see that Ayodele is beginning to act out of norm, I give you permission, full permission, to run after me, to send me messages, to come and knock my door without
Hmm.
telling me you are coming, to
Hmm.
send me emails, to keep hounding me until you get to speak with me and you get to the root of the matter. Because what tends to happen with us men is this: everybody, we think every man is the king in his own castle.
Hmm.
So when somebody suddenly begins to not respond to texts, not respond to messages, we leave them to their whims and caprices and say it will come round to it.
Hmm.
Unfortunately, some of them don't come round to it, because the first time we find that they've come round to it is that it does happen that suddenly people, their friends, have been invited to their funerals because
Hmm.
they have actually been left alone to do their own thing, and they got to the point in which they thought there's no point continuing, and they hopped out.
So you are verging on the point about discussing suicide in that instance. So one, what are the hallmarks of suicide or the pre-suicide state? How common is it in black men, particularly not just in men now, but in black men? And what can we do? I know you've mentioned the issue there of community and society in terms of looking after people, looking after each other, and wanting to check up on one another. But what, how common is suicide? And actually, what do you define as suicide? And yes.
Okay. So suicide is when there is a clear evidence that somebody died by taking their own lives. So that person's death occurred as a result of something they deliberately did to take
Mm,
their own lives. And we know that in the UK, for instance, it's about 11.5 per 100,000 of the population. Um, and we do know that in every year, just about 6,000 people die by suicide in the UK. 6,000. But what's more worrying is that 3 out of 4 people that die by suicide are men. 75%. Yeah, 75% of people's suicidal deaths is occurs in men. Um, so in terms of the risk factors, so we do know that black men in the UK, for instance, are at more risk. Middle-aged men are at more risk, and then people who are undergoing unemployment,
mm,
poverty, financial difficulties, all
mm,
of those, and of course, particularly depression is a high
mm,
risk. Um, uh, there was a study in Europe that actually traced. They looked at all those who died by suicide. They looked at their GP records and really went back, and they found out that almost about 1 in 2, about 50% of them had one link or the other with depression. So, an untreated depression, the risk of dying from untreated depression, the risk of dying by suicide from an untreated depression is 1 out of 5. So, 20% of people who have untreated depression will die from suicide. So it's quite not and it's untreated. It's
mm,
important to qualify that, but that's why it's important for us to be able to pick up on symptoms of depression, uh, so that people can be supported, because it's a treatable condition. But when it's not treated, things can go out of hand, and that's when people verge on going to suicidal experiences.
And I see that you've mentioned particularly middle-aged men, and you've talked about things revolving around aspiration, because those are the people that are more likely to lose their jobs. Those are the people not likely to be promoted. Those are the people that are likely to have life stress issues. They are the ones that are more likely to suffer from empty nest syndromes.
Yeah,
They're the ones that are more likely to have marital discords.
yeah.
So, what can we do, particularly as black men, in this kind of environment that is very alien to the way some of us have been brought up, or our cultural differences? Because yes, as a black person, our culture, even though we're meant to be multicultural, may be slightly different from the European culture. So what can we do, and what should we be looking out for?
I think the first thing is that we need to, as a community, continue to educate ourselves about these things. I think that just like there's public health education on prostate cancer, on
Mm,
cancers, and all that, it's important for us to educate ourselves, so that we not only, if we cannot not only spot the symptoms, if one has the symptoms, but also in others. That's one. I think it's also important that we also foster um, a culture of vulnerability,
mm,
a mutual vulnerability, peer vulnerability among middle-aged black men. I remember that, I think this was in July. I was speaking at an event, and I said, I know that all of you came with your masks. I know, I'm in the midst of black men. I know what I'm dealing with. I said, by the way, to start with, I'm on stage now, and I'm publicly putting off my own mask. So I'm encouraging you all to please put off your own mask. Let's talk eye to eye. Let's
mm,
really talk about the crux of the matter.
mm,
And I think that's what it is. I think it's important for every one of us to realize that we're all in the same boat.
mm,
the shade or the color or the size of what we are dealing with might differ from time to time. But the reality is that we are all in the same boat.
Mm.
And the other reality is this, that people say, "Oh, men don't talk." That's not my experience. I always counteract that, because that's not my experience. Because find that men talk to me, and the
Mm.
reason I feel is that men are looking for safe spaces.
Mm.
We are
Mm.
fixers as men. a,
Yes.
a man brings a problem, and before he even finishes, our head is already calculating how we are going to sort his problem
Solid.
out for him,
Mm.
as if he hadn't thought about that before he came to us.
Mm.
So and as soon as we then open our mouth, he hasn't even finished what he's saying. We open our mouth and we begin to give advice. The man thinks, okay, fair enough. You are never going to catch me being vulnerable like that before,
Mm.
because a man doesn't want to feel like he doesn't measure up, particularly when he's talking to other men. A man doesn't want to feel humiliated. A man doesn't want to feel that he's not in charge of his life affairs, no matter how critical and dire things are. He still wants to hold that persona that he's got everything together. So anything that is critical, that is judgmental, that makes assumptions, will will get will make him turn up. It will just basically
Mm.
become defensive.
So I listened to one of the talks you gave recently, and I think you used a term that struck me. It's okay not to be okay. What do you mean?
Yes. So basically, what I mean by that is, it's okay for us to have a group of people. And like I said, I think the spouse, the wife, is the most important person that needs to know. Because sadly, as well, many times when these things sadly happen, it's amazing how many women will say that they even didn't have a clue about what was going on in their husband's life,
Mm.
because the man was so
Closed up.
guarded that he didn't even speak to anyone. So it's okay not to be okay means that it's okay to accept that I don't have things together at the moment. Actually, I've not been sleeping well for the last few months because such and such is happening. I've lost interest in all aspects of life because such and such is happening. It's okay not to be okay, in the sense that we are not meant to have it all together all of the time. There is
Mm.
no one who is like that.
Mm.
It's okay not to play the victim of these societal stoic expectations of men, where we are not allowed or permitted to show any emotions.
Mm.
We are not allowed to break down in public. We are not allowed to be vulnerable. We are not
Yes.
allowed to be weak. Uh, and that's a problem with leadership as well. Unfortunately, sometimes it goes across board, and sometimes with spiritual leadership,
Mm-hmm.
that there's this image of a a formidable um, um, defense that is uncrackable, and the message that that sends to people is that there is something wrong with me if I don't have it all together.
Mm.
So if everybody is saying everything is okay, everything is okay, everything is okay, even though it's everything is not okay, it's just that every one of us are wearing masks. So you put on your mask, I've put on my own mask, and we're looking at each other at our mask and thinking, wow, this mask looks so good. I wish I had a mask like that. If only you saw his face.
Yes. Okay.
And he's looking at me and thinking, wow, Ayodele's mask is spot on. It's really, it's the best I've seen so far. So really, it's about being able to admit that there is being able to have an intimate group of people that you can really be vulnerable with. And there's an agreed understanding between the parties that we're not here to criticize each other. We're not here to look down on each other. We're here to listen more. Um,
Mm.
I think that's really the important, really being good listeners.
So it looks like the one thing that you mentioned that I was saying, that women have a role to play. Wives trying to know their husbands,
Yeah,
mothers knowing their children,
yeah.
and daughters also knowing their fathers to see if and when there's any change.
And
The
sisters
other
knowing
thing,
their brothers.
and sisters know their brothers. Sorry, I didn't mean to forget and neglect anybody there. So we've talked about a lot about mental health. So what are the treatments available for mental health, and how can we treat? Who do we treat, and when do we treat?
Right. Okay. So it only becomes, so everybody has a bad day now and again. It only becomes a problem when it interferes with functioning, social functioning, family functioning, work functioning, or functioning in the society. It's only when it interferes with any of those realms, like I said, like we talked about the man who doesn't come home until 11 p.m., or it gets to the point in which he's drinking so much that the next day he's not able to get up for work. Those are the times where it's when there is an impairment of function. It's not able to do the things it we usually do. That's when treatment is necessary. And sometimes treatment does not have to be tablets. It doesn't have to be even therapy. Sometimes it's just a change of lifestyle, um, abstaining from drugs, abstaining from alcohol, but also things like exercise,
Hmm.
things like exercise, things like even being exposure to sunlight, things like having a structure to one's day, things like engaging in the things that give you pleasure. Even for instance, if somebody is unemployed, they've been used to commuting, they wake up at 6 a.m. every day, they hop on the train, they go to London for work, but suddenly they are no longer able to do that because there's no job. And then they have hours and hours on their hands that they don't know how to account for. So being able to structure that time and do and fill it with something meaningful that makes them feel that there's a sense of worth as a man would be important. So that's one form of treatment, social prescribing of all sorts, but also medication. Medication in terms of antidepressants, sometimes antipsychotics, sometimes mood stabilizers, all of those. But the important thing is to say that a lot of people have misgivings about medication, particularly antidepressants. They say, oh, anybody who starts antidepressants never gets or comes off them. That's not based on evidence. People can actually use antidepressants for a short while, until they are well. 6 months after they become well, they can be weaned off antidepressants. And of course, there's also talking therapy. And I do know black men don't do therapy. I know black men do, at least. And I cannot overemphasize the benefits of going to therapy, because I mean, some of us, as a result of our upbringing, have been traumatized over and over and over again, and we're holding it together and thinking that, oh, there's nothing wrong, there's nothing wrong, but it's like a loaded gun. It's just waiting for the right time. When the time is right and the trigger is pulled, one will be surprised at how the power of that explosion. Recently, somebody told me, somebody said, "Oh yeah, that the benefits of having these one-to-one sessions with me cannot be quantified in money."
Hmm.
So it does work. It certainly does work, but many times it's because we don't understand what takes place there. So we feel, oh, who is going to go and sit down? They will just be playing with your head and playing with your mind. But really, it's effective.
Yeah, because when you look at those American movies and they say they go to, I hate to use the word, they go to their shrink, they sit in a comfortable space. One person just lets the other person talk and talk and talk. And at the end of 1 hour, the bell goes, fine, time is up, see you next week. So is that what you mean by therapy?
So that's unfortunately, that's still what people believe in, that's what therapy is like. Honestly, therapy is like the conversation we're having right now.
Okay.
Obviously, because if I in this case, you would have been the therapist, because in this conversation it looks like you have said a lot less than I've said. So basically, you're just asking me the right questions to get me to say the things that I know.
Okay.
And that's what therapy is. Therapists are trained to be able to ask the right questions, to strike the right chord, such that the people they are talking with are able to express what's in their minds. But it's not just what's in their minds, to touch on the fundamental issues. And then the therapist asks questions to help them to rethink and redefine their realities, such that over time they can begin to change.
Okay. And so people talk about something called CBT, cognitive behavior therapy. Is that a form of therapy in itself?
It is a form of therapy.
Okay.
And
And the
it's the
one,
most common one. Sorry, go
okay,
ahead.
Karen, you finish about therapy, because there's just one more thing I need you to touch on before we finally end today's session.
All right. So cognitive behavioral therapy is one of the forms of therapy. It's the most versatile and the most commonly recommended one, most commonly available as well in the UK and most places because it's very uh, it's the one that is quickest. People can train to become therapists very quickly, and then people can also deliver the therapy. And it's for things like anxiety, depression, modulated forms of it for post-traumatic or specialized form of it, obsessive compulsive disorder. But it's really about helping us to identify basically the way we think affects the way we feel, and the way we
Mm-hmm.
feel will affect the way we behave. So
Yeah.
therapists, CBT therapists help us to identify the way we think, the toxic thinking patterns that lead to the difficult emotions that then lead to behavior, and that cycle is perpetuated. So they help us to challenge our thoughts, think right, and then it affects our moods, and our moods affect our behavior.
Okay. So the one thing that I wanted to ask you is there anything called midlife crisis? And if there is, what is midlife crisis? How do you identify it?
Right. I think that at any point in our lives we could face crisis. But as you have said, that when a man begins to get into middle years, the late 40s, 50s, and 60s, that certain things happen. The nest becomes empty. Sometimes it's also a time when somebody is beginning to think, okay, when I retire, what am I going to do? So the
Mm,
questions, the deep questions of life that we've been running around not facing for a long time becomes
mm,
things that are now staring us in the face.
mm,
Sometimes, sadly, people would have also had losses in their lives. At those times, most people, or that's the time when people also
mm,
begin to lose their parents. And
mm,
parental loss at any point, it's a huge deal.
mm,
So all of those things are happening, and the chickens begin to come home to roost. And if one doesn't have those support systems in one's life, then it can become a huge deal. So basically, that's so there's so many life changes taking place
mm,
during midlife, and quite a number of them entail losses, change of roles, change of careers, and all of those can then begin to cause one to introspect. And if one introspects too deeply, without any outlets, safe outlets,
mm.
then that can be trouble.
But then we hear about people in the middle ages acquiring new cars, sports cars, start getting bikes, taking on challenges such as cycling excessively. But then that's when they start to do join golf clubs. So is that detrimental? Is that something to watch out for? Is it something just to say, you know what, fine, that's you expressing yourself, or when does it become a negative thing?
I think it becomes a negative thing when it's excessive. When it's so, if somebody, for instance, joins a begins to buy new cars when they're in financial debt, so they
Mm-hmm.
are really treated. So it's a maladaptive way of coping.
Okay.
Or somebody who, I mean, they are not interested. They've not really showed a flair for cars before. They start acquiring cars,
Mm,
so it's certainly, and obviously some maladaptive ones. Somebody just suddenly they've been married for 25 years or 30 years, and they suddenly think that now is the time to acquire a new wife just because of medication. I mean, those things are really, they're alarm bells that this is not
mm,
right.
mm. Well, Dr. Adele, I want to say thank you very much. I know I can carry on asking you questions. There'll be no end to it, but at some point we need to try and moderate things. And also, I want to say thank you for giving up of your time. I mean, look at the time; it's almost 10 o'clock on the Monday evening. So I just want to say thank you very much on behalf of Hangout Cafe and the baristas that are going to watch this. If there's one message that you want to pass before you do end, what is that one message that you want to pass? I mean, I've taken lots of notes, which I'm going to try to summarize, but I can't even begin to summarize. But if there's one message you need to pass across, what would that be?
So the one message will be to middle-aged men that you are not alone in whatever challenges you are facing. Please speak to somebody. Um, please develop confiding relationships, one or two people that you can really trust and you can bear your minds to. And if you've experienced any trauma in your life, please do get help. It's okay to get professional help. It's not a sign of weakness, it's actually a sign of strength.
Thank you very, very much. It's been a pleasure having you, and I'm sure we'll interact very much more in the very near future. Thank you very much.
Thank you, too.